Thank you, Catherine. Millions of people here in the United States have diabetes, and nearly 40% of the country's adults are pre-diabetic, according to the CDC. To help people understand their risk, Carilion Clinic Community Health and Outreach is connecting with our hometowns. Here to tell us more is Community Health Education Manager Rachel Burks. Thank you so much for being here today.
Thanks for having me.
This is a really important conversation to have because what you're trying to do is educate people about their risk and, of course, how they can do some prevention efforts as well. But before we dive into all those tips, what is diabetes?
So diabetes is a chronic or long-lasting health condition that affects the way that our bodies turn food into energy. So for all of us, when we eat, the food gets broken down into sugar that then enters our bloodstreams. For people without diabetes, that blood sugar then can enter the body's cells and be used as energy or stored for later. For somebody with diabetes, sometimes that blood sugar has a difficult time getting into the body's cells. So then there's too much blood sugar in the bloodstream. Sometimes there's too little blood sugar in the bloodstream. So when you have too high blood sugar, too low blood sugar, or it's fluctuating everywhere, that can cause some both immediate and long-term health challenges. And that's kind of the primary issue with diabetes.
Absolutely. It's about not really finding that balance with that blood sugar. And there's ways to do some prevention methods, but I want to know closer here at home. We looked at those national statistics. What's the problem here in our backyard?
Yes, so nationally, diabetes rates have been increasing both for adults and children. For adults, 1 in 10 American adults has diabetes, and that's tracking here at home as well. And then, as you mentioned, for pre-diabetes, over 1 in 3 American adults has pre-diabetes, and we're seeing that here at home as well. So it really starts with knowing your risk, because diabetes can be prevented. So pre-diabetes really just means you're at high risk for developing diabetes, but you're not there yet. And there are so many things you can do to reduce your risk.
I love that, because you can take action now. There's something that you have the power over. So talk to me about some of those ways that we can even figure out our risk.
So what I recommend to people, if you don't know your risk, a great way to find out your risk is taking the American Diabetes Association risk test for type 2 diabetes. You can do a simple Google search for it. It pops right up. It's a free test. It takes 2 minutes to complete. You answer a few questions, and at the end you get a score. If your score is high, I think 5 or higher, you should really talk with your healthcare provider about your risk.
And I think the best part about this too, we have that URL there on your screen, but it's available in multiple languages, so it is accessible to our communities across all different language barriers, but all different types of people as well. Something else we want to talk about is that, like we said, there are steps you can take to make sure that you're going to get healthy and not fall into this diabetic state. So what are steps we can take now, all of us, to maybe be a little bit healthier?
So in general, diabetes can both be prevented, managed, and even just delayed by taking really small steps in your lifestyle. These are things like eating a little healthier, being a little more physically active, and taking steps to reduce your stress. We always encourage people to start with something very small and realistic for them. It can be as simple as replacing one sugary beverage that you drink each day with a glass of water. And then, of course, working with your healthcare provider is always something you should do. Take your medications as they're prescribed and follow instructions to manage your health conditions.
Bite-sized goals is the easiest way to achieve success.
Yes.
You also have resources you want to highlight for our viewers there at home about ways that they can maybe get support on a healthier lifestyle journey. What are those?
Yes, so Carilion Clinic has a variety of resources that you can take advantage of. The first, Carilion Community Health and Outreach offers free health education and wellness classes and programs, both online and in person, that you can enroll in, and they can really support you on your health and wellness journey. You can look for online Carilion Clinic calendar to see what's coming up. Also, Community Health and Outreach has community health workers that can have a one-on-one appointment with you and help you reach your health goals as well. Those are also free appointments, and you can call us to find out more and to schedule an appointment. And then finally, Carilion has a wonderful diabetes management program for people with diabetes who really want and need that more specialized support. And you can simply talk with your healthcare provider about that program, get a referral. It's usually covered by insurance. I also wanted to bring up Virginia Cooperative Extension's Diabetes Prevention Program. This is a wonderful, again, free resource that you can enroll in that can help you make those modest lifestyle changes that we talked about already to really help you prevent diabetes and reduce your risk.
Excellent. Yeah, so Rachel, I love this because it's accessible and it's affordable. We had the information for Carilion Community Health and Outreach on our screen just a little bit ago, but you'll find more of their information on our website as well. Thank you so much for these tips and of course for acknowledging November as Diabetes Awareness Month.
Thank you.
Absolutely. All right, well, stay with us on Here at Home. We're going to check out all of